one of the things that we had hoped in this documentary is to empower that patient to know whether they're in California, Washington, here in Florida, the Miami area, or anywhere in this country or in the world, as a matter of fact, what questions do they need to ask when they're sitting in that chair, interviewing, because the doctor works for them.
Absolutely.
Right?
Absolutely.
Interviewing the doctor. What would be some of the questions you would recommend a patient to ask in that setting?
That's a great question. And I will tell you, the first question I ask patients when they come in is, where else have you been? Mm-hmm. I always start with that. So I also know have they been to 3 places before, 4 places before, no places before? And sometimes they almost act like guilty to give a response, like, oh, well, I've actually been to 3 other places. And I tell them, of course, I would expect that. This is a big decision. And I would expect you going to numerous places and interviewed them, okay? And I put their mind at ease about that. That's normal. That is what I expect. I joke with them, of course, and then say, this is the final place you need to go, okay? So what do they need to know is, the biggest thing is they got to know the credentials. They got to know, is this person done 1,000 of these procedures, 100 of these procedures, none of these procedures? Where is he on this?
On the experience level, yeah.
Yes. So they've got to know those credentials. Is how experienced is he on this? Then they've got to know we already talked about, is financial options, to see if this is something that is going to be doable for them. If it is fear is one of the issues. They got to know about what kind of sedation is available or not available, or how quick it's going to be, or how slow it's going to be. They got to know about the team.
Huge.
Because that makes a huge difference. You haven't been a patient, you know that.
Yes.
Good nurses, good assistants compared to not good nurses. It makes a huge difference. Good is welcoming is reception, not welcoming reception. A good laboratory that can get things done on time or not get things done on time is about the team. And it's different to simply ask the question, how good is your team? Great. How good is this? Great. But to ask for examples so it's important for patients to ask those types of things. How long does the lab take? Where is the lab? What kind of lab do you use? Can I meet the hygienist? Can I meet the front desk? Of course, they've already met. To get to meet the whole team.
That's a great point. And, the team aspect of it really is underrated by most patients, because they think it's just the doctor. Now, the doctor is the captain of the team, yes, but it's the team that makes the victory.
Huge difference.
And I've seen...
And as a patient, you know that.
Yeah.
Yes.
And in the roles we've been in, dealing with a lot of different clinics, I've actually had to not take on services for clinics, because I've noticed, look, I don't want our name associated with this, because the doctor might be pretty good, but going back to that businessman, which really is the assembling of the team, is a big part of it. And so...
And leadership skills.
Yes, absolutely.
Yes.
And what you attract. And so how would you as a patient, not having the knowledge I've had in the past, just a patient that's normally coming to you, how can they really know what kind of team? Because you brought up a good point. Well, how's your team? Good. What doctor is going to go mediocre, right? I mean, so how would you really sift that out if you're a patient?
Honestly, I don't know a good way, because my dad fell recently, about a year ago, needed some neurosurgery. So I was in the opposite role, not myself as a patient, but helping my dad go through that. So finding the surgeon it wasn't emergency surgery, so he had time. So I went with him, and I was in that role, because it's neurosurgery on the brain, on my dad. I want the best in the world is for him. But do I fly him to another city, or is the best right there? Or do I want the best in his town? And interviewing them. And I don't have resumes of the staff. So what am I looking for? I'm looking for my telltale signs of clinical competence. When they're taking his blood pressure, I'm looking for telltale signs of their friendliness, of their communication abilities. That's what I'm doing. For the surgeon, I did look up his credentials, and then I asked other people about him as well as other physicians at the hospital. So it would be asking other folks is it would be looking up as much as you can about his credentials of the doctor. And with the team members, really for me, it was observing telltale signs, because if they're excellent about each detail, if they're excellent on how to put the blood pressure cuff on, I'm assuming they're going to be excellent on the post-op care. If they're sloppy putting the blood pressure cuff on, I'm assuming they're going to be sloppy with post-op care. Not always a correlation, but oftentimes those that are pickety sneaky on this thing are going to be on other things. Those that are sloppy on one thing may be on other things.
Yeah.
And so I was looking for those kinds of telltale signs.
You know, and the confidence level, you know, you can pick up on that as a patient. Does that assistant look like just a new hire, that they are so timid and scared to do anything? How's their interaction with the doctor? You know, that's a big piece of it. You know, some of the doctors, actually the doctor who did my surgery, you know, his assistants, he doesn't even have to talk during it, because they've got that communication that's even nonverbal and respect. And so do they have a respect for the doctor, and does the doctor have a respect for them? Can they pick up on that? I think that's an important piece.
That's excellent.
And I think that, you know, you touched on something else that, you know, I when it was my mom's turn, before I did, even though I had some relationships and I knew some clinicians, right? I was just getting into really growing our business, working with other implant doctors. I decided, you know, I want to go see and interview the big boys, you know? And so in Dallas, we have a handful. So I went to Clear Choice.
Yes.
You know, I wanted to see what's the hype about.
Exactly.
I went to Arch Point. I went to go meet Dr. Mike Golpa at his new practice there. And so, and I went through all the consultations, and I got to see some of this. And I love the fact that some of them, when they would find out you've been to other consultations, would seem offended, which the patient, you brought up a great point, that this is a life-changing event, and rarely do you find that right when the first time. Sometimes you do. We interviewed somebody in Atlanta that did, but it's pretty rare. So don't feel embarrassed if you're a patient. And I'm so grateful as you, as a clinician, don't make them feel that way.
No, it's like buying a house. I mean, you may circle back to the first one you saw, but you got to see 10 others.
Yeah.
Buying a car, you go to several places. You may circle back to the first one.
Right.
But it doesn't mean you're always going to, and it's the same thing with important is work like this, is second, third, fourth opinions, absolutely.